Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the hip. It is Fitzgerald Test. Now this test came about in 1995 by Dr. Robert H. Fitzgerald. And from what I could find about him, he has done a ton of work and research in the hip and is like an expert in the hip. And so he developed this test to look at the labrum to detect if there was a tear in the labrum, either in the anterior portion or the posterior portion, because it may have gotten missed and then you send the person off for MRI. So just trying to speed things along. But anyway, let's get in on how to do it. To perform this test, you have the person lying supine. We're going to flex the hip up. Then what we do a little external rotation. Then we're going to do some abduction here. And then we're going to take the person into extension of their hip through here. And this is testing the anterior aspect of the labrum. And a positive for this would be a production of pain with or without a click. Now, to test the posterior labrum, we'll have a little bit of abduction out through here. I'm out here. We do a little internal rotation, adduction, and then bring them into that extended position again. And once again, a positive is pain with or without a click. Now getting into the research on this test, it's kind of hard to find a lot on it. They really reference that first study quite often, the one that Dr. Robert Fitzgerald performed. And in that article, he had 56 people with hip issues, did this test. 54 of the 56 had a hip labral tear, so they said the accuracy is 96%. And because of all 54 of them were positive, the sensitivity is 100% of it, and also the positive predictive value is 100%. Now, looking through just a bunch of articles, just trying to find some other numbers, I will say they just referenced that article. They just kept referencing that back. It was hard to find something that was like specific to just looking at this test again. And so it's just said like, well, in your assessment of the hip, do the Fitzgerald's test to assess for a labral tear. But anyway, there you go. That's it on it. But I will say as well, for the specificity, I did read some things that just referenced to say the specificity is pretty low on it. Anyway, take that how it is. But anyway, let us know, what do you think of this test? Do you use it? Do you like it? Do you think we need to do more research? Let us know down in the comments below. And as Mateo always says, take care of yourself. Take care of your patients. We'll see you next time.